Hi, this is the town hall for the COVID crisis in Siskiyou County, what we can do. And we are going over the process for what we are going to do this evening. As I said, we'll begin with the speakers giving about a 5-minute presentation on what's going on in COVID in their areas and some thoughts on what we can do as citizens. The audience will remain muted throughout the town hall. Through the chat function, you do have the opportunity to ask questions, which the speakers will answer after they've all finished their 5-minute presentations. The chat function is located, as you probably all know, because we've been Zooming for a while, but if you don't, it's at the bottom, it says chat. You can direct your questions to everyone. And even though it says everyone, your questions really are going to go to the hosts and the co-hosts. So we will be reviewing the questions, not the entire group. And we'll monitor them and organize them for the question and answer period at the end of the session. So let's get on with our presentation. To provide you with an overview, we have 7 great speakers who've taken their time on a Friday evening, which is great, to be with us. First up will be Dr. Stutz, who is our Siskiyou County Public Health Officer, and we're excited to have him and hear what's going on in our county. We will then hear from our North County professionals from Fairchild Medical Center, Jonathan Andrus, who's the CEO, and Dr. Moudy Youssef, who is the medical director there. They'll be followed by our South County representatives from Mercy Medical Center, Rodger Page, who's the CEO, and Elizabeth Pulatie, who's the VP for Patient Care Services, and Dr. Malee, who is a physician there. We will end with our comments with our Board of Supervisor member from Mount Shasta, Ed Valenzuela. And then after that, we'll go and address the questions. So thanks in advance to all our speakers. We appreciate their time, and you are on, Dr. Stutz. So let me, seeing how you can.
Can you guys hear me?
Yeah, I should take the rest of these. I'm going to do remove the spotlights from all the others, so you'll only see the one speaker. It'll take me just a second.
Well, I'm gonna get going here while you do that.
Sure.
So thanks for having me, everybody. I was excited to hear that the community was interested in putting this town hall talk together. I'm not going to speak for terribly long, and I'm not going to bore you with a ton of data. But I will start by showing you a little bit of a PowerPoint presentation that I created, just covering the current numbers and some past numbers for the county as a whole. That includes both hospitals, people outside the county who are county residents, deaths within and without of the county, and you'll see it. So I'm going to share my screen here. So just the monthly COVID numbers for the year 2021. You can see that we did have a little bit of a winter spike that then tapered off. And we've, generally from the beginning of the pandemic had a pretty mild impact from the pandemic. I attributed it initially to our rural area here and the fact that we're largely socially distanced much of the time anyway. And then, at the beginning of the year, you'll remember that the vaccine became available, which is our biggest tool against COVID. I think the public had access to that sometime in February and March. So the vaccine kicked in around then. Before then, it was mostly social distancing, masking, and all those things that we've been exhorting people to please do since that time. Our lowest COVID numbers were in June. And at that point, everybody was, pretty excited that we were seeing fewer than 5 cases a day in the county. And then somewhere around there, the Delta variant hit us. And we know that because of the whole genome sequencing that we were doing, as well as other counties and other places in California and in Southern Oregon. And we know that essentially 90 to 100% of current cases here right now are from the Delta variant. And so that led to this current surge. It's happened all over Northern California, all over Southern Oregon, and other parts of the state and the country. So we are not immune. And part of the reason I was really happy that some community members wanted to hear from us is because I feel like a lot of the community doesn't realize that this is going on locally. Our hospitals are besieged by COVID patients and patients with other medical conditions that that are impacting the healthcare system in a really negative way. Fairchild has created extra ICU beds. This is coupled with a nursing shortage that has happened nationwide for many reasons, not just because of the recent state mandate, but even before that, we were suffering from a nursing shortage. So it's kind of a perfect storm of things happening to our healthcare system here and making it really tenuous. When our hospitals are as full as they are, it becomes very difficult to care for everyone, not just the COVID patients, but also patients having heart attacks and strokes and traumas and things like that. When we don't have bed space to put them in, coupled with the fact that we're having a difficult time sending them anywhere else when they need higher levels of care, it creates a very dangerous situation. So I'm going to go on to my next slide, but of course, it's not working. There we go. So complex slide, but what I did was I zoomed in on the surge part that we've been experiencing for the past, I'd say 6 to 8 weeks. So those blue bars are the new cases every single day that I've had data from late July 29th. That was the week before the surge started to kick in. We were seeing numbers that were fewer than 10 per day. And then you can see that, sometime around early August, we began to see increased new cases per day. And if you're just looking at the blue bars, you can see that we've kind of surged to sometimes more than 70 cases a day. I think we even had more than 140 cases in one, but that wasn't really in one day. So a lot of those days where you see large surges, that's multiple days put together. Like maybe we had a holiday and we didn't get data reported on that day. So sometimes 3 or 4 days are lumped into one of those bars. So you can see that the surge is kind of peaked and leveled out there over the last 8 weeks or so. The green line represents the hospitalized patients for each one of those days. So you can see that the green line started out pretty flat, and then sometime in the first part of August, about 2 weeks after the surge started, that started to go up as well, and that it's still going up. If you look at the end of the chart there, we're still seeing an increase in hospitalized cases today, and that's expected because even though the number of cases per day has sort of leveled off, we expect the hospitalized cases to continue to go up for another 2 weeks, even if the number of new cases per day stays the same. The small purple bar down at the bottom is the number of ICU admitted patients. And you can see that's still going up as well. So I also expect that to continue going up. And this slide is kind of, if you don't like graphs, this is more of a number format for you. So over the last 3-4 weeks here, these are our numbers. So the testing positivity has started about, in early August, it was about 16%, and then it went up to 18 to 20%, and it's maintained at 18 to 20% positivity rate. That's the number of positive tests divided by the total number of tests that we've done for COVID, right? That's a really high number. Back during the low part of the pandemic, when we weren't seeing a whole lot of cases, we were having less than 5% positivity rates. The positivity rate for California as a whole is less than 5% right now, and we're at 18%. So that's an indicator that we have a huge disease burden in our county right now. The average new cases per day, that next row, you can see there, it's been coming down over the last 3 weeks, which has really made me happy. From the 50s to 40s to 30s, and now for the last week that I have the data for, it's been about 27.4 new cases per day. That's still a lot of cases. That puts us at 40 cases per 100,000 population. So we're still in a substantial transmission according to the CDC. And then you can see the deaths down there, which, since we don't have very many deaths every day or every week, it's hard to really see a trend. But in the last 10 days, we've had about 10 patients die. And that's really unusual. That's a 20% bump from what we experienced for the entire pandemic. And then the last slide, this is the last data slide I'm going to show you all. Today's hospitalizations, these are the total number of patients in hospitals who have an address in Siskiyou County, right? So there's 22 Siskiyou County residents that have been hospitalized as of today. And these numbers may or may not agree with what Fairchild and Mercy, not Shasta, may provide, because these are the numbers that I have available. They may have more current numbers. So we have 22 patients admitted in various locations. 17 are in the ICU. And you can see they're in the ICUs all over Northern California and even in Oregon. So we have 12 ICU patients at Fairchild and 1 at Mercy Mount Shasta. And then the other ICU patients are out of county. Some of them are in Oregon, some of them are in Shasta County. And then we have 5 patients who are just on basic med surg beds. So they're the less critical patients, but they're still admitted to the hospital, right? So this is interesting because, and telling, because we don't have 13 ICU beds in this county. Normally we have 8 ICU beds, 4 at each hospital, right? So to have 13 ICU level patients in a county that has 8 ICU beds is a huge problem. And it doesn't look like a whole lot to people who aren't in healthcare, but to us, it's a massive problem because we don't have the staff, we don't have the equipment, we don't have the supplies, we don't have the space to take care of these patients. Couple that with the difficulty that we're having sending patients elsewhere to get that help that they need, because other places are impacted too, and it's creating a huge disaster situation. So I'm going to stop sharing my screen and I'm just going to talk for a little bit. So, you know, this is my call to the community. And in addition, I'm sure many people saw the letter that I published and that Public Health put on their Facebook page, with, you know, a number of signatories, all providers in the county, PAs, NPs, physicians, hospital administrators, nurses, people who are respected healthcare workers in our county. You know, just asking our community to do the one thing that is the most effective to tamp down on this COVID surge, and that's to get vaccinated. I've been giving some vaccine hesitancy talks around the county and in other counties, and people do to help out with this. Well, invite me to come give a vaccine hesitancy talk somewhere. That's one thing. Get your own vaccine. Convince other people to get their vaccines. Also, you know, we should remember those things that we've been asking people to do for a long time: mask wearing, hand washing, you know, social distancing. Not engaging in large group activities for the time being is probably a good idea. Maybe save that birthday party for a couple of months, or, you know, don't go visit grandma at this time, you know, in Siskiyou County or otherwise. Refrain from, you know, visiting those places where you're probably getting get exposed, or where you might transmit it to somebody else unknowingly. So those are all pieces of advice that I have, and it's kind of, at this point, it's in the hands of the community to do something about this. It's always been in the hands of the community, and, you know, with public health can only do so much, right? So what we're doing every day is trying to secure resources for our healthcare workers who are overburdened, right? So that we have state nursing staff coming in and pharmacy staff coming in tomorrow to help FMC provide some monoclonal antibody therapy. So that's going to be that's through a state program, as well as providing supplies to clinics and hospitals in our county to meet this demand. You know, all of the vaccine clinics that we did last year and that we're going to start up again this year in conjunction with our influenza vaccine pods. So, but there's only so much that we can do. You know, we're understaffed. We don't have the staff and resources that a lot of bigger counties do, and we don't have the budget either. So a lot of this is going to be on the community to do what needs to be done to make wise choices and keep yourself safe. I don't want to talk for too long because a lot of the interesting commentary usually happens with the questions in these meetings. So I'm going to stop talking and let others talk for the time being.
Well, thank you very much, Dr. Andrus. I'm going to turn it over now to, I'm going to remove your spotlight. And Jonathan Andrus. Where are you? There you are. Okay. Are you there? Are you muted?
I'm there. Can you hear me okay?
Yes.
Okay, great. Yeah, appreciate the opportunity to be with you this evening. It just occurs to me as Dr. Stutz is talking that I just want to start by thanking the healthcare workers across the county that are going above and beyond right now to care for our communities. And I think if there's one thing you can do, one takeaway, I want you to join me in recognizing and showing appreciation for your healthcare workers that are working so very hard, lots of personal sacrifice to care for you, your family members, your friends, your neighbors. It's a very difficult time. I can certainly confirm that from my perspective, we've seen a significant increase in demand for critical care services. We've got more than 50% of our beds right now full of COVID positive patients, patients on ventilators. 91% of these patients since the beginning of the year, but including this month, basically for Fairchild, 91% of the COVID positive patients are unvaccinated, so 9 in 10. And basically the length of stay for these patients is twice what our normal length of stay is. Really seeing some long lengths of stay, which is significant because it decreases, capacity, decreases availability, and just makes the shortage of critical care even worse. Just to share with you a couple thoughts on crisis care. Some of you have probably seen that term and just want to kind of share what that means. But on September 13th, we actually kind of escalated because of the difficulty of the situation and trying to care and meet the demand for critical care. We moved from conventional care to crisis care mode. What that really means is we found a way to expand our critical care capacity beyond our usual boundaries. As Dr. Stutz just shared, we typically routinely have 4 critical care beds here. We added 6 more, and so more than doubled our critical care capacity. And by definition, that's probably the biggest component of this term that we use, crisis care. It also requires significant changes in our staffing. Of course, we can't find right now, the marketplace just doesn't have the staff to offer that we need to keep up. The nurses aren't there. Other licensed professionals aren't there. In the past, we might be able to go out and get staff on a temporary basis just with a phone call. It's not possible anymore. So in large part, these providers here in the county, we've had to navigate this on our own. So we stopped doing elective surgeries. We moved all of our surgical nurses out onto the floor. We reduced what we're doing in our outpatient clinics, and I've got LVNs from the clinics over here working in a team-based nursing model underneath the critical care nurses and the other RNs working day shifts, night shifts. So we've had to reduce services available in other parts of the organization so that we can meet some of the staffing requirements. And this hasn't been easy. I mean, again, I've got nurses. I've got one nurse from surgery who's put in 100 hours this past week working some night shifts for us in other parts of the organization. As I mentioned, some of these LVN nurses come from the clinic and working night shifts. I've got one of my med-surg nurses that's worked 12 out of the last 14 days. And so we're tired. We really are. I can speak for the staff. Our respiratory therapists have been some of the staff that have taken the brunt of this in recent weeks, and again, it just hasn't been possible to bring in temporary staff. So we've been kind of on our own, and not only just from kind of a quantitative perspective, but I think from an emotional perspective, it's been a really difficult time for healthcare workers because we're losing patients, and it's difficult for staff to be with these patients for many days, if not a couple of weeks, and then to lose them. And so the part of dealing with the emotional trauma, the death, has not been easy either. And so I can tell you that there's been kind of an emotional toll that's been taken in terms of the healthcare workers and what we're trying to navigate. So the other piece, in addition to staffing, as we talk about crisis care, is just supplies. Often when we get into this crisis care mode, we're rationing supplies. We're having a hard time keeping up. Fortunately, I don't think we've had to ration on either end of the county because we've been working so closely together. I think that's the other point is we've worked very closely with the county, the state, CDPH, and then Rodger and I we're talking, if not several times a week, and they've been very good to help us. For example, last week they were able to get us a couple of ventilators. But we've been very close to having to ration equipment. Oxygen's been one of our biggest challenges over the last week. We have had a hard time finding, sourcing, and supplying enough oxygen to take care of these patients. Our use is up 18-fold over what our normal use is, and it's just been very difficult to keep the portable tanks that we use to find them and keep them full of oxygen so that we can take care of these patients. But again, it's a little bit more stable today. Our usage is down just a little bit, but the supply piece is the other piece when we talk about crisis care. So when you hear that term, again, expanded critical care capacity. We're using different staffing models than we normally use, and we're working hard to make sure we can find all the supplies that we need. One of the questions I've been getting too is kind of the background of all of this. We're dealing with several state mandates around testing unvaccinated workers, around the vaccine mandate itself. And that's actually been a difficult journey in and of itself over the last 8 weeks since that mandate was received. We stated early on what our intentions were. Our board, our medical staff, administration all aligned and said we support the mandate. We expect to enforce the mandate on September 30th. And we've worked long and hard to help our staff understand that intent and help them understand their options, which really are at this point to get the vaccine or to get a qualified exemption, either religious or medical. And I'm happy to report that 94% of our staff at this point are either vaccinated or have a qualified exemption, religious or medical. And that is not a coincidence. We've worked very hard to make that happen. So that's where we're at in terms of the mandate. Unvaccinated staff that have the exemptions will continue to be tested twice a week, and there's some additional testing or masking requirements that we'll be meeting as well for patient care areas. And so if you come to receive services, again, please know that it is a safe environment. We are doing everything we can to keep it safe in terms of all of our safety policies and protocols. One last thought. I think there's been some misinformation going around the community, and something that I've heard several times in the last week is that this is good for the hospitals financially, because there's money out there that the more COVID patients we have, the more money we make. And I want to be very clear that that's absolutely false. I expect to lose $100,000 this month at the hospital. And, you know, if you look at what's happened in California hospitals last year, for example, in 2020, even with all the provider relief money, hospitals lost $8 billion in California last year. 2/3 of hospitals in California last year were at break even or worse, right? 2 out of 3. And in 2021, California hospitals are expected to lose another $2 billion. Our reimbursement, and there isn't a bucket of money out there that's going to make up what we're having to spend. Our revenues are down. When you shut surgeries down, revenues are down, our expenses are up. We are losing money, and there isn't, I don't make more money by having more COVID patients. So please help me dispel that notion that this is good for hospitals financially, because it is not good for hospitals financially. And it's a very difficult time for us. It's going to be a difficult time for a long time financially, in terms of being able to operate and continue to do all of the things that we're trying to do. So anyway, there's just a few thoughts from my perspective. Again, demand for critical care services remains very high to this day. We're very hopeful that with some of the active cases trending down, that things change soon. We really appreciate our partners, both, again, government, public, the county, the state, and private partners, Rodger, Mount Shasta, and some of the other private companies have really stepped up. We actually have a company on the oxygen situation that we've been working with, and we're going to have a 9,200-gallon oxygen tank on the back of a truck in here within 2 weeks. and we really had to work hard to make that happen. But we've got some good private partners as well. So anyway, workforce is working hard, the healthcare workforce going above and beyond, lots of personal sacrifice. When you see your healthcare worker, give them a hug, tell them thank you. We appreciate it.
Hey, thank you very much. We appreciate it. Okay, so we're going to hear from Fairchild again. Dr. Moudy Youssef, I'm going to spotlight you. There you go.
Can you guys hear me okay?
Yep.
Okay.
Yes, we can.
Excellent. Well, thanks for having me in this forum. Anytime I have a chance to kind of talk about vaccination, I am right in there. Just like what Jonathan and Dr. Stutz say, this is crisis. I mean, it has been very difficult since the beginning of the pandemic, but I did not think that we're going to get into this position after, and that long after, the resurgence of the vaccine. It almost gives me flashbacks about what happened in Italy at the beginning of this pandemic. But now we have the vaccine and we have this, and it is tough on patient, family, medical staff. Hospital resources are squeezed down to the max. And I would like to add on top of this, I mean, the demands for regular access of care is actually higher. We have been seeing a lot more strokes, heart attacks that we usually see anyway before the pandemic, which adds more resources. We have seen more stroke patients the last 2 months than the prior 6 months. I mean, the last 2 months alone, 50 patients in 2 months. That's a record for Fairchild. And it has become emotional as well. And I'm not talking about the staff who are, really squeezed down to the limited resources. I'm talking about also emotional for our community, both who are for and against vaccination, which it shouldn't be. I think the amount of misinformation out there have been also driving a huge part of this vaccine hesitancy, and there aren't enough ways to combat that I can think of. One thing also I would like to kind of mention, besides, I mean, we say that there's a lot of constraints on our health system and all these dooms and glooms, but those vaccines really work. And what does work mean? And when they first designed, they were not just meant to prevent infection, it's to prevent severe infection where ends patients up in the hospital, both ICU or even death. And that's what we're seeing now, that severe infection with patients in the ICU, intubated, and death, and they're vastly unvaccinated. Whatever we can do to kind of combat that vaccine hesitancy, and I'm not really sure what else we can do, but I'm gonna bring just a quick notion because it happens to be a very common question among patients and some employees that they come ask me about this. And I know patients who had, or friends of mine who had the vaccines, they still got COVID. The question I usually ask them, were they on a life support or have they died? And that's the issue. So, the media are really obsessed about antibodies, and antibodies is just only one way that the immune system can really deal with the virus as part of that vaccination. There's something called T-cell immunity. There's something called memory cells. You can have undetectable antibodies, but you have good immune system against the virus. And not because somebody doesn't have antibodies, that's a failure of the vaccine. And we have seen this repeatedly where in patients with certain immune issues or a lot of comorbidities where they have not really developed much of antibodies, which antibodies are tasked to prevent infection, not severe infection, preventing severe infection or hospitalization. That's T cell immunity. And those patients did get, vast number of them, get COVID, but they didn't overwhelm our hospital. They were not in our ICU or even admitted. And that's the thing. The efficacy is there. The safety is there. And the misinformation about changing DNA or it affects, that's another common one I've heard, it does affect sterility or instability. So they're safe, they're very safe. And I don't want to just go through like the data right now, but what we worry about is very, very limited. And one of the things that actually halted the distribution of J&J early on, I think in April of this year, was this issue with clotting and thrombocytopenia. Well, if you look at the data at the end, it's basically 4 in a million, and I think I would have better chance winning the lottery than getting that. So they are safe, and I think we need to do a better job in distributing how is it safe, and I'm not really sure how else we do other than venues like what we're doing right now. Just like Dr. Stutz say, I think most of the discussion and benefits will probably come from questions. But I'm gonna yield right there and see what my colleagues have to say.
Thank you very much, Dr. Youssef. So I'm gonna switch down to South County, and we have Rodger Page, who's the CEO at Mercy Medical Center. You're on.
All right, thank you. I'm going to just highlight some things because many of the things that have already been said we are experiencing, and I want to make sure that I leave time for Dr. Malee and Elizabeth, our chief nurse, to give their perspective and also for the questions. I'm going to start with what you as our community and county members can do is continue to encourage people to get vaccinated. It's as you're hearing tonight, there's huge impact, not only in the community, but in the hospitals and limited resources. At South County in our hospital, we've had fewer COVID patients than what you heard Fairchild's experiencing. However, our overall hospital patient numbers have been quite high. Last week, almost to capacity, and Dr. Malee can talk more. And we are experiencing, like Dr. Youssef said, those other patients are very, very sick. So not only do we have a stress on our staff, and trying to care for the COVID patients, but also very sick patients at staffing levels that we aren't usually staffed for. Jonathan mentioned the collaboration of the hospitals. We meet and collaborate with the county, and we work often. I don't know if our community realizes how often we interact with each other to try and ensure that we're providing great care. I would say back to the impact on staffing, it is difficult, like he said, and you'll hear from others, and Elizabeth, to get outside resources. Many of our leaders are working actual direct patient care shifts. And you saw the numbers for our county, and you might wonder, well, why don't we just transfer these very sick patients out? Often we'll transfer Jonathan and even us up into Medford or down to Reading to the 2 hospitals there. And the numbers in Shasta County at the 2 hospitals last week, there was 114 COVID hospitalized patients at those 2 hospitals. So our ability to transfer is limited, and you'll hear that. And it's been surging in Southern Oregon as well. It does impact, we're pretty much any inpatient elective surgeries, and we apologize to community members. We're having to reschedule some of those, and we're trying to work around that. It's an inconvenience, and also we understand when you come to the hospital, you're getting met with visitor restrictions and things. That's part of the mandate, and also to ensure that we provide a safe environment to you, to our staff, and to our leaders. So I'm going to leave it there to leave time for the others. I do want to end with a big thank you to our healthcare workers, our physicians, so many that are pouring in so many hours to ensure that these patients and our community is cared for.
Thank you very much. And I will remove your spotlight and we'll go on to Elizabeth Pulatie. Let me put you on spotlight for everyone. There you go, Elizabeth. Okay.
Yeah, thank you very much for having me here tonight. I do want to echo, what everybody else has already said. I really, really appreciate my staff. As Rodger pointed out, many of my leaders have been pulling shifts. I myself helped out the ICU last night. I've helped in the ER, not a whole shift, but multiple hours, just because we don't have the staff. And we are very, very high census with very sick patients. Our COVID numbers by and large have been lower down here in South County. However, we've seen a higher incidence of traumas, strokes, addiction has been a huge issue, behavioral health patients. We have had to hold patients in our emergency department for 3 and 4 days to try and find appropriate placement for them, which puts an even greater strain on our emergency department. Our volumes there have been up around 300 cases a month, which for a little critical access hospital is quite significant. Makes it a challenge, making sure that we're providing the great care that we really focus on, that's safe and effective, and being able to have the staff that can manage that. So as Jonathan said, I do have many staff working lots and lots and lots of extra hours, staff on 18-hour shifts, pulling extra shift, working days and nights. And that's through the department, throughout the hospital, multiple departments. What can the community do? Support us. Really, really consider the vaccines. I agree completely with Dr. Youssef that vaccinations are quite safe. Myself, my whole family have been vaccinated with the goal of keeping ourselves safe, but also keeping our patients and our community safe. And I personally believe as a healthcare provider that I have a responsibility to do everything I can to keep my patients safe. And that includes not transmitting something that I can prevent getting through wearing appropriate personal protective gear and through vaccination when appropriate. Vaccinations for healthcare workers have been an expectation for many, many years. Hepatitis B, and we just had titers drawn a couple years ago for MMR and chickenpox. And, if our titers were low, we were expected to get vaccinated again. This is not a new thing. So again, I encourage vaccination. Though there are people that have valid reasons, and I do believe we need to respect their reasons as much as we are able.
Okay, thank you.
I'll leave it for questions.
Okay, perfect. Hey, thank you very much, Elizabeth. Let's go on to Dr. Malee. Let me look and spotlight you. There you are. Okay, you're on. Oh, I think you're muted still. Can you unmute?
I'm mute. Can you hear me here?
Yeah, just speak a little bit louder, I think.
You hear me here?
Yes, we can hear you.
Okay, excellent. I'm Sean Malee. I'm actually local Northern California person, learned to ski up in the old ski ball Mount Shasta, and have lived most of my life in Northern California. board certified internal medicine doctor and lead hospitalist here, as well as director of the cardiopulmonary department, which leads me just to, because this crew, my cardiopulmonary team, somewhat under-recognized crew of people who are truly in the face of this disease, working long shifts and over and over in the rooms of these patients, at peril to their life. And so I just want to recognize respiratory therapists for the work that they do. We don't hear their name mentioned that often, so just important. So our shop, as you can imagine, has been tremendously busy. I count my blessings that I'm not in a position of Dr. Youssef. We've been able to stay within our ICU. We do have 2 intubated patients in our ICU now, just to update Dr. Stutz's figures. And given what we've seen in terms of the case positivity rate in the county, we can expect to see large volumes of COVID patients coming through our facility for a while to come. We've been really working with care coordination, getting home oxygen. So part of the thing that's unloaded us a little bit is we've been managing folks at home with oxygen, even using some therapies that are generally used in hospitals in the home setting, because these folks are getting oxygen. So that's maybe unloaded us a little bit from a census, but like everyone's seen, the total volumes in the hospital, trauma, and the usual medical issues that wind up on our floor are no less and at times more than we've seen. And combining this with the nursing staff shortages that we're seeing, hospitalist staff shortages. One of our main hospitalists, actually the doc that worked the most shifts, has retired, and we're relying on locums and desperately searching for new hospitalists to fill those leads. Everybody is working longer days, and it's, I appreciate Jonathan speaking to the stress, trauma, and emotional trauma. A lot of these patients are here with us for extended periods of time. We get to know them. We spend hours with their family, and it's really tough to see these folks die. And oftentimes, as the pandemic has progressed for us, as the Delta variant has become a bigger and bigger part of what we're dealing with, we're seeing younger patients and people that really shouldn't be dying of this disease. Early on, we're thinking of it as taking out the nursing home patients and very elderly and ill, but these are vital members of our community. They're people who should not be dying, and it is really rough on our teams. We're struggling. I couldn't be more proud of the people I work with, but it's hard. I think one of the big things that really is an emphasis, I think everyone has talked about this, but the concept that we can no longer transfer patients, and I mean, we're struggling. The rural hospital model has existed on the concept that we can provide outstanding services to what we can do, but we can't do cardiac catheterizations. We don't have surgical and medical subspecialties. And the mainstay of our practice is, people in rural areas get all disease processes, including ones that we can't take care of. Always been able to transfer. I've worked in this county for 21 years, and I have never been in a position where I'm unable to transfer a patient who should not die from a critical illness to a critical care doctor. That's never been a part of our game. And so we're here and, taking care of these people, and I'm proud of the work that we're doing, but we're not university-based critical care doctors. And, it's hard. It's a huge tax to our team to really have to up our game and work outside of our wheelhouse. like Beth said, she was in the ICU with me for hours last night, side by side, trying to keep a quite young woman alive from severe COVID-19. And, you know, we're working outside of our norms. We're anything that I've ever seen in my career. If anyone is out there is doubting that this thing is real, you know, I would love to see you walk in the shoes of some of us that are in there providing this care at this time. It's exhausting and terrifying. You know, everyone's working at a really high level and doing the best we can, but we can't keep doing this. All you need to do is get your calculator out and look at the number of people left in our county who are unvaccinated. We've only had 4,000 infections and we're getting overwhelmed. We have 26,000 people out there that are susceptible to this disease process. And that's pretty terrifying. You know, so the big, you know, one of the questions I think is, where do we go? How do we move forward from this point? We're at 42% vaccinated. We have about 19,000 people in our county vaccinated. We have about 26,000 people who are unvaccinated. And, you know, at this point in time, I think we're going to see those vaccine age limits drop. And, you know, so there's going to be probably 20,000 people out there that are still susceptible to this disease. With time, some of the big indicators of why people are hesitant to take the vaccine is when what they're seeing in their social channels, on their news channels, on their social media is fear of the vaccine and not fear of the disease process. We're going to see lower vaccine rates and a lower uptake on people getting this vaccine. So if our media and if we can share the word to say, yeah, folks, this really is a bad disease. People really are dying who should not die of this disease process. And, you know, let's be realistic about these side effects, vaccine side effects, and the risks. The risks are very minimal. And, you know, there's going to be a lot to learn over the time to come when we can compare side effects of this vaccine. But there's quite a bit of data, and, you know, over 200 million Americans have seen this vaccine in their body. And, you know, and the side effect profile is looking pretty safe from this point, and the disease is looking pretty bad. And that's, I think, you know, we're not going to change the minds of the hardliners who have integrated not taking this vaccine into their identity. We're not going to change those minds. And that could be, you know, 5,000 to 10,000 people in our county. It's hard to say what those numbers are, but with good information, I think we're going to shift the minds of some of these vaccine hesitant folks who are mostly fearful for their own safety. And if we can get that information out to prove safety, and that's going to be a big help in vaccine uptake. But in best case scenario, that might get us up to 70% in our county where we're getting close to herd immunity, but it might not either. So what are other ways that we can do as community members to move forward if you've decided you don't want that vaccine? Personal responsibility. This is what if, you know, like when I raise my children, they want freedom, they have to show responsibility. So personal responsibility. When we're sick, we can be cautious, not go out in public, go get a COVID test. I would love to see rapid home COVID testing that you can do in the privacy of your house become available and affordable, and just see that increase on a huge basis. I think people would really appreciate to not have to go to the hospital and not have to go to Rite Aid. So I think that could be a change that helps us manage this pandemic, you know, and look at the risk factor out there. The risks for dying of this disease and ending up in the hospital for those who are unvaccinated. are pretty clear, advanced age. I think one of the things that's understated is the fact of being overweight and obesity, even very mild obesity. We're not talking about folks that are extremely obese. Just a bit overweight really increases risk in this disease process. And taking that into consideration, diabetes, heart disease, assess your risk, try to be as healthy as you can, is going to make a difference. And
Yeah.
of course, the vaccine, we want to see that. We want to see as much vaccine as possible, as that is clearly proven to be the best answer. And the last thing I want to say is just an echo of a thought of compassion towards healthcare providers. There's a lot of misinformation out there. It has come to the point that there is aggression and microaggression towards healthcare providers, doctors, nurses, and we're all working at our maximum, and we need compassion. We need the community has trusted us to care for your heart attacks, your trauma, your strokes for decades. So trust us. We are the same doctors. We are using the same sources for information that have allowed us to provide evidence-based, safe care for you for decades. So trust us.
Okay.
We're there for you, and we're going to keep working as hard as we can to keep you healthy and safe. So
Okay, thank you very much. Okay, we're going to go on to our last speaker, Ed Valenzuela. Just talk a little bit about.
Yeah, real quick, because thank you. And I want to just.
We have a lot of questions, so yeah, that'd be great.
Yeah, I just, because I'm not the medical professional, I trust the medical profession and I want to thank them for all that they've been doing. I mean, this has been a brutal 18 months that we were going through. I believe Dr. Stutz mentioned it, we don't have the resources like some of these bigger entities, and we're up against it. And I will tell you that the reality of it is Siskiyou County is not isolated here. Most of the rural counties are in the same predicament. There's a lot of hesitancy. There's a lot of anti-vaxxers. The Board of Supervisors meeting within the last month, we had to deal with that. I think me and two other people were the only ones wearing a mask. I had asked the CAO to, hey, we need to shut that down. We can't have our own little super spreader event. I just hear recently in our last board meeting, doing my part, we need to have every meeting an update where we're going. We have to soft sell it. By nature, people in the rural counties are conservative, so that there's a reluctance there. I think they feel like they're being dictated to. If you recall here recently, the Board of Supervisors sent a letter to the governor, which I did not sign or support, pushing back on a healthcare mandate. I don't understand that. I can't speak for them, but again, in a rural county, I think this is something that you see throughout the state of California. With that, I don't want to continue on. I want to see what the questions are. So thank you for the time. And again, Thank you to the healthcare professionals.
Thank you very much. What I'm going to do is I'm going to spotlight all of our speakers, and then I'll ask the questions. Let's see if I can. The first question, though, let's see. Let me get Aaron up here. I'm going to direct this one to you, and I'll additionally spotlight people, but why haven't schools been closed with the positivity rate so high?
Yeah, so that's an easy answer. Schools haven't been closed because the state is requiring us to open them, right? So everywhere across California and much of the United States, schools are required to open. Most of California is trying to power through this, despite the high numbers in some counties. I got to be honest. I think it's a brave approach to power through with these numbers, and it is risky, but I support opening the schools. We've been in communications with the school systems, weekly since the beginning of the pandemic, and they've developed a lot of really strong procedures to try and keep their schools safe. Right. This is the way out of the pandemic. we have to power through sections of the economy like this, knowing what we know over the knowledge that we've gained over the last 18 months or so. We have vaccines available. They're going to be available for children pretty soon. And this is the way through the pandemic. We can't just keep everything closed. We have to find reasonable ways through the pandemic, and taking a reasonable approach to risk benefit analysis. And I fully support opening the schools right now because, honestly, it hasn't been a huge contributor to our numbers. I would say we were getting numbers in schools. We are seeing COVID in schools, but I don't think it's been, we haven't seen pockets of outbreaks here and there where it's contributing to the majority of our numbers. So I got to say, I think it's one of the most important parts of our community, keeping the schools open, and it's number one priority for me. Shortly behind keeping the hospitals from overflowing.
Okay, and an added question to that, someone asked about vaccines for kids under 11 or under 12, I guess. Do you have any idea when that's coming?
Oh, I'm hoping by the end of the year, but we're just waiting on data. So we're just waiting. It's going to go through that whole process, FDA, CDC, and the Western State Scientific Regional Group. So.
Okay, so this is a question for Rodger Page and Jonathan Andrus. Of the total 22 that are hospitalized, how many were at Mercy? And it sounds like there were 2 ICU patients at Mercy, right?
That's correct. And we have, I believe, a total of 5.
Total of 5 patients. And then I think you gave the numbers, Jonathan, but I don't know. I don't remember them. You have some in the ICU, like quite a few.
Yeah, as of this morning, we had 14 hospitalized COVID positive patients. So 14.
And how many were in the ICU?
Oh, I think we had 4 in our main ICU and 2 or 3 in ICU South.
Okay.
No, Dr. Youssef, do you know? Actually, I should ask him.
It's just that I'm going to take care of the ICU South starting tomorrow. There's 8 patients in ICU South right now, all COVID, in addition to the 4 in the north.
Yeah. Okay,
We have a north and south ICU. Now, this is a question, it's a physician question. Can you outline the difference between pre-Delta and post-Delta variants in terms of severity of symptoms, change of necessary treatments, number of vents used, needed, etc.? So it's, I guess, the severity of the disease. Based on anecdotal evidence only, I don't believe the general public in this county has an understanding just how amplified this new variant has changed the game. So I don't know.
I
Go
can
ahead,
speak to that too, to some degree. I think the big highlight of the Delta variant, and I would say the thing we know most about it from a factual standpoint, is it is a much more transmissible. So there's, for the R factor, that the number of people infected per person with the infection is much higher, so more people are being infected. That being said, from a totally anecdotal standpoint, we're just personally in Mount Shasta, what we're seeing, and what I've heard from North County as well, we're seeing younger patients getting sicker, people with a lower risk factor profile getting sicker, going onto the ventilator. These aren't people who at the beginning of the pandemic really thought they might die from this disease, are getting sick enough to die. And, from reports of my colleagues in Reading, same thing, 20s, 30s, lots of folks in their 40s and 50s with not a big disease burden are getting sicker.
Okay, you want to add anything to that, Dr. Youssef? Does that sound good?
I wouldn't mind adding a little bit to that.
Okay.
Yeah, so I think part of the question was, what is there a difference in treatment? No, there isn't. COVID, variant A is treated the same as COVID variant B. And last I checked on the state database, 100% of the whole genome sequencing results that we've had in the past couple of weeks were Delta variant. So that speaks to how transmissible it is. It's basically pushed out all of the other variants at this time.
Okay.
I'm going to make two more additional points. I have seen few numbers of reinfections on Delta, but the other good part about it, it is very, very susceptible to the vaccine, just as pre-Delta variants as well. And that's more of a reason that to get people vaccinated, because it is scary. It spreads easier than the flu, and it's just as deadly. So, and the vaccines are very, very effective against Delta.
Okay, great. Someone asked if you're going to be able to obtain the recording. Yes, we have it recorded and we'll send out a link to all of you. So we'll have that out later. Now, this is I don't know where this question goes. The Siskiyou Patriots are hosting their own meeting tonight in Wairika with Mercy and Fairchild Medical staff, or Fairchild Medical Center staff. Their flyer calls in vaccinations. Those who spread misinformation using their healthcare profession. If that's allowed, the misinformation will spread rapidly and gives them validation. Do you know anything about any of this and what might be going on and what the hospital can do about it?
Yeah, Robin, it wasn't tonight, it was last night. We weren't invited to the meeting. I don't know anything about it. We did put a disclaimer that we weren't invited, and if anybody spoke for Fairchild, that wasn't on our behalf.
Okay. Any other comment on that?
No, just
Yeah,
that would be the same for Mount Shasta. It was not on our behalf. It could be employees, and that is their own personal opinion.
And I would say I also unfortunately wasn't invited, although I would have very much liked to have been invited.
Okay. Both hospitals, how many patients are seeking emergency care or urgent care but not being hospitalized? You know, I guess there's something out there that people are going to the emergency room, but there's no beds. Is that correct or not?
So we're treating every patient that needs care, even if that means holding them in our ER. So we don't discharge anybody that's not safe to discharge, and we discharge them with resources and clear instructions if that's the case. But we do treat every patient that needs care. We find a way to do it, even if that means my leadership is pulling shifts on the floor to make it happen.
Okay.
Demand for emergent services is really, really strong right now. We have a walk-in service out of our rural health clinic, and demand's been really strong there. The emergency department's the same thing. In fact, so much so that this weekend I'll have 2 physicians in the department covering, actually for the, through Monday. So yeah, we're seeing a lot of demand, and we are required to screen and stabilize all patients, and that's exactly what we're doing.
Okay. Any other comments from people? Okay, so is there any consideration of requesting resources and staffing from the state health department or the California National Guard?
So yeah, all of those requests have already been placed. Every week we have meetings with regional disaster medical health specialist and Cal OES, Cal EMSA, et cetera, et cetera, et cetera. Everywhere in the state is putting in requests like this, and resources are incredibly limited. We were lucky enough to get assigned a handful of nursing staff and some other staff that are reportedly going to be here this weekend. So the state is focusing on the problem, but again, they're experiencing the same problem that every other hospital in America is experiencing right now. There's still a shortage of workers, still a shortage of nursing staff and other allied health professions. So state can't get the help that it needs to help us either.
Okay.
This team of 4 nurses and a doctor that's arriving at Fairchild tomorrow to focus on the monoclonal antibody therapy process is going to be a huge help to us. Maybe a little bit late to the game, but we are so grateful to have them. It might be appropriate for one of the docs to just talk briefly about the importance of monoclonal antibodies as we go forward, but we got to get as much of this stuff out as we can.
Yeah, I could sort of fill in the blanks about what kind of therapy is offered when you do get diagnosed with COVID. So what that monoclonal antibody team will be doing is providing infusions to patients that have been diagnosed with COVID or maybe had a significant exposure and at a high risk. So that's what's been happening out in Del Norte County, right? So early on, they had their surge a few weeks prior to when we had ours, and they were one of the first Northern California counties to get hit very, very hard by Delta variant. And so at that point, the state was able to give them much more significant help than a lot of other counties have gotten thus far. So there's a whole team, several physicians, 8 or 12 nursing staff, pharmacists, respiratory therapists, 20 ventilators went out there early on, about 6 or 8 weeks ago. And so unfortunately, we didn't get a lot of that handed out to us because by that time, a lot of other counties needed help too. But what they're doing out there is they popped up a state-run EMSA clinic, and they're doing testing, vaccination, and monoclonal antibody therapy, 9 a.m. to 6 p.m. Like Monday through Saturdays, 6 days a week out back of the hospital. It's really, really helped that community. And so that's why, we placed an order for that kind of help here. And we got some of it, but not to the same extent. So the therapies that if you get diagnosed with COVID, monoclonal antibody therapy would definitely support getting an infusion. The data was questionable at first, and now it appears that it does help prevent hospitalization. So hopefully we'll have that available here in this county shortly.
Okay. Here's a question for Ed Valenzuela. Ed, if you could unmute, that'd be great. The board signed the anti-mandate letter and you did not sign it. Will you be releasing your own statement publicly?
I'm not sure. That's a good thought. I hadn't thought of that. I think I made my spiel at the Board of Supervisors meeting. Unfortunately, the media that we get is very limited. So I personally just try to work behind the scenes, talking to people and trying to encourage them just to get vaccinated and to do the right thing. Obviously 4-to-1 vote is typical what I deal with, and I leave it at that. Thank you.
Okay. Thanks, Ed. Okay, so about the Mu variant, do we have any MU variant cases in this county? Yes or no?
So that's, it's hard to tell because again, everybody thinks we just sequence every test, every positive COVID patient here to find out what version we don't. We only send a select handful of cases for sequencing. That's probably only a couple a month. And that's only for strange cases like, well, this person has been living in a hut, not seeing anybody for 2 months. How did they get COVID? What variant do they have? Or they're vaccinated and they get COVID really badly. Like why? You're a young person. So we just don't have the capability. Well, nowhere has the capability to sequence every positive COVID test. When we send a COVID test down to Richmond in California to get sequenced, we get a result maybe 3 weeks later. So it's far too late for us to make any actions based on that result. We can't make any clinical decisions on it anyway. So it's really more for academic interest and for public health, record keeping. So I can't say that I've seen any new variant come across my desk thus far. It's been almost all Delta or sub-variants of Delta in the last 2 months.
So how do vaccinated best protect themselves, especially teachers in schools?
I could, chime in there again. The school thing is really important. So if they can adhere to their protocols and really be strict with the students, wear your mask. If you're not wearing your mask, you're out of here, back to your, back home. The protocols that we've come up with are probably sufficient if they're adhered to, very stringently. It definitely, we have a lot of school systems in this county. It's not like other small counties where they just have like one unified school district. We have a lot of schools and school systems here, and there's a lot of varied opinion. And I've some of the schools don't have the resources, or they're way out in the hills, and it's very difficult for them to obtain testing resources and things like that. There are many programs available through the state that most of them have signed up for to help out with that. So as long as they can adhere to these protocols, and when they have a problem or an issue, they can be free to contact public health for advice. That's the way to keep themselves safe. Adhering to the Cal OSHA guidelines, adhering to the state guidelines. and adhering to their own policies that they've come up with. And I've sort of allowed all of the schools to come up with their own policies and procedures, because it's not a one size fits all situation. Some schools can't distance people by more than 3 feet. They just can't. They have small schools, almost every school has they're required to have a distance learning option. So even if the school is open, people can request that their students, be go on to distance learning. That's required. So there's a lot of policies and procedures in place, a lot of checks and balances. And if they adhere to those, and if people don't come to school sick, they don't come to work sick, they don't send their sick kid to school, that's the key piece, right?
Yeah. Okay, so we've got a lot of questions still. So I'm gonna ask for like a 1-minute answer on these. Why is vaccination the one and only solution? Why not early treatment protocols that are proven to reduce symptoms? Like ivermectin, zinc, vitamin C, and
Answer
D.
that question, and I can do it in
Okay.
1 minute. Hydroxychloroquine was basically debunked last year. It doesn't work. The data is still out on ivermectin. Even if it does work, it doesn't work nearly as well as a vaccination, right? It's, so we're waiting on, there are several clinical trials in the clinical trials database here in the United States that might answer that question by the end of the year. So we'll know more. But vaccine is your best bet by far and away. It's not the only thing. Wear your mask. Don't go to social gatherings. Stay away from people for this time period where we're getting crushed by COVID. Don't start harping on these medications that are unproven. You're not going to find a whole lot of physicians supporting those things. If they show that they're effective in the data, we'll start using them. Only then. That's the end.
Okay, so with the increase of COVID, this is for you, Dr. Stutz, in Siskiyou County, the last 2 months and the publicity around this, have you seen more people being vaccinated? And what's the percentage of those in Siskiyou County who are vaccinated?
Yeah, so because of the current numbers and because of all the outreach that we've been doing and the publicity around hospitals, we have seen a bump in the numbers. We're still only at a total of like 46.8%. And that's like 30-something% in North County and 50-something% in South County, if you want to just group the county into 2 large groups. So we're still way far behind. But yeah, we have seen a bump because of all the publicity.
Okay, good. Now, the question kind of along those lines, why has it taken months for the local GP and to write a letter of support in the vaccinations? I think those were letters of support that were signed by a lot of health professionals. This letter was needed months ago with the initial vaccination push. What took so long? But also, are there ideas? Because one of the other questions that we had actually before the session today was, how are you publicizing that letter that was written by, I think, up here, it was signed by 79 health professionals. So maybe Fairchild and Mercy could answer that. Just kind of, it's that letter that went, or maybe it was you, Dr. Stutz, that wrote it. I can't remember.
I created that letter as I adopted a letter that was written in another county. I really liked it, and so I made it our own and had our own healthcare providers sign it. And why wasn't it done months ago? Well, silly us. We thought that people were just going to want to get the vaccine.
Yeah.
I didn't know that we were going to have to hold people's feet to the fire to get a life-saving vaccine. So that's why. And that letter didn't come out in any county until a couple of weeks ago. All right. So we publicized it by putting it on social media, on the Facebook page for public health. We could certainly, I think there was one question maybe that somebody wanted it put out in the newspapers. We can certainly do that. Will it help? I don't know. I hope so.
Yeah. Okay. Are grocery stores and other businesses required to ensure patrons are masked? Grocery stores and other businesses.
Sorry, what's the question?
The masking requirement. Are they required to have people have masks in grocery stores and other businesses?
No. I mean, right now in our county, there is not a masking mandate. I struggled with this because out in Del Norte, where I'm helping out with the pandemic as well, that community really wanted a masking mandate. Every member of the Board of Supervisors was in agreement. Every single one of them. There was no dispute. They wanted a masking mandate. They had a morgue truck parked outside the mortuary collecting bodies for everyone to see. And the entire community contacted public health and said, we want a masking mandate. It was very easy. We had huge support from the community. Here in this community, crickets. I have run this by so many people and nobody wants it. Nobody wants to do it. Nobody wants to be forced to wear a mask, to do a simple thing like wear a piece of cloth in front of their face to protect their neighbor. So it's not, again, it's not a one size fit all approach to this pandemic. What's right for one community may not be right for another community. Does it help? Well, the communities that so I'm in contact with health officers from many other counties, right? Many of them have masking mandates and many of them don't. The ones that did engage in a masking mandate tell me that the data looks like masking mandates don't work for the people who aren't going to wear the mask, and they do work to protect people who are going to wear their mask. So the vaccinated populations, their rates of breakthrough infections went down slightly after the introduction of masking mandates. The infection rates in the unvaccinated population continued to go up or level off. So, will it work here? Maybe. Is it a little bit late? Maybe. I think we can all take this into our own hands and do what we want with it. We should be wearing masks. We should not be, engaging in social gatherings at this time. If you're not going to get your vaccine, those are the things that we can do.
Yeah. Do businesses have to report employee outbreaks and do contact tracing?
Yeah. So when we either they report it because there's a state requirement, or we notice in the reporting that, hey, there were 4 cases from this business. And so, I get weekly updates about various outbreaks around the county in businesses, schools, whatever.
Yeah. Okay, so I'm going to try to wrap it up around 7:30-ish or so, but we've got a lot more questions. But the physicians, just a quick question. Are you seeing any long COVID symptoms? And can you speak about treatment options like antibody infusions? So the physicians.
Yeah. Yes, there is actually a term now of post-COVID syndrome, and it's a multitude of things, mainly just kind of persistence of some symptoms that developed with COVID infection. But quite often, even after resolution of symptoms, patient developed these kind of vague constitutional symptoms. Some of them are like lupus-like as well. And we've been seeing a lot of that in my practice. Now, in terms of management and treatment, well, just like Dr. Stutz said, there are certain management like monoclonal antibodies early on that can be given, but also for hospitalized patients, there are certain protocols. Some of them are like steroids and remdesivir, and there is the other interventions like the NEBs and the MAPs, which we have hard time getting anyway. Now, for post-COVID syndrome, there is no specifics. There is no specific therapeutic interventions. It's still kind of early on that we have not found anything that's, I mean, you can treat some symptoms, but, in terms of true therapeutics and a cure, no. And that's one of the prices we pay for actually going through the disease. And we see it more, actually, that's another thing too, but this is anecdotal. I don't know the data about it, but I see this in patients who never got vaccinated and went through the COVID infection and developed this post-COVID vaccine. But I don't know what if there is actually data about post-COVID syndrome and vaccinated breakthrough infections.
Okay, next question. How can we feel that vaccines are safe when the VAERS report showed that over 14,000 deaths from the vaccine and thousands of vaccine injuries?
So,
I would love to answer that question, but go ahead, Sean.
Yeah, Aaron Dr. Stutz can speak to this also. The VAERS data is just a reporting network. It's important to realize these are folks that have reported side effects. That data needs to be compared with the data out there of people who aren't vaccinated and compared to the incidence of those given diseases, deaths, cardiac events, inflammatory disease processes that people are reporting compared to the general public. And so just because someone reports an event after the vaccine does not make a causative connection. And I think that's a misunderstanding, that if it shows up on the VAERS website, that it is a vaccine related, it is just it's a gathering place for people to report effects. So I don't know, Aaron, if you can add anything to that.
Yeah, I would add that. So yeah, it's a reporting system that there's no checks and balances. Anybody can report their adverse event and say that somebody died after their COVID vaccine. But even for a physician, it's very difficult to tell if this event was caused by vaccination or not. For example, when I'm in the emergency department seeing patients, and somebody, let's say a 27-year-old female comes in and she gets diagnosed with a pulmonary embolus, a blood clot in her lung. And she says, gosh, I really think this was the vaccine. I got my vaccine 3 or 4 weeks ago. Possibly, yeah, who knows? There's no test that we can do to really prove that that was or was not a result of the vaccine. But we do know that people, who are 27 years old do sometimes get pulmonary emboli just without the vet, even before COVID, right? So how do we tell if it was secondary to COVID or not? And, this is part of the vaccine hesitancy talks that I've been giving, is actually going through the actual side effects that have been identified, not only in VAERS, but in other actual studies from the vaccine manufacturers and other third parties. We actually have noticed a trend in some side effects, but most of that doesn't come from the VAERS reporting system because it's too unreliable. So if you want to hear about the real, side effects of the vaccine, invite me to do a vaccine hesitancy talk, and I'll talk all about all of the actual things that have been linked to vaccines, the actual side effects.
Okay, great.
And I'll
Okay,
add
is
just
there?
a very quick thing,
I'm
because
sorry. Sure.
this is another question, that very similar question I got from one of our employee. This is unprecedented. I don't recollect in the history of humanity that we delivered 6 billion doses worldwide in a single year. There's over 400 million doses delivered in this country alone, 182 million fully vaccinated. So if we're talking about, if 14,000 is an impressive number, this one is. I think comparatively with the number of deaths from COVID, you can tell me the risk and benefits, right?
Got it. Okay, good. Is there a plan to release frequent and more accurate information to the public from the hospitals as well as the county? Like, we heard some information tonight that we weren't aware of. And I think that's the idea, is how can we get more information out to the public?
Well,
Maybe the hospitals? Yeah,
yeah.
Rodger?
I'll just jump in. For us, we have a lot of information out on our social media pages. And if you go out and look at Dignity Health, you can see question and answers on COVID vaccine efficacy, and also some videos from our physicians speaking to that.
Okay.
Yeah, and I would just add, we're a very small community in a very small town, in a very small hospitals. We're very cautious giving real specific information on a daily basis because we really value our patients and our community's privacy. But as Dignity Health for our North State market, we are working hard to make sure that the numbers, at least for our system, are updated on a regular basis.
Okay. And how about with Fairchild information?
Yeah, I think that some of this, it's kind of have some of the same thoughts that Elizabeth just shared and Rodger shared. I think we are, I can't tell you how much reporting that we're doing right now. And I think, to put it simply, I don't have the resources to report any more than we're reporting. And so we're doing a lot of reporting. We're working closely with the county, with the state, and we're just so stretched for resources because I'm taking care of patients that I just can't do any more than we're doing right now.
Okay. Great. Okay, so I think we'll wrap this up. The last question we had is, how do we voice our support for a masking mandate? I know you said that.
Talk to your board of supervisors. I'll consider it if I get enough feedback from the community and they really want it. You know,
Okay.
it's within my power to do, but I don't like doing things that the entire community hates. You know, it's really hard for me to make that decision. So yeah, voice your support.
Great.
I have just,
Um,
no,
yes.
excuse me, Robin, just
Uh-huh,
a
sure.
real brief comment on that I don't know that we covered. You know, there's a lot of concerns come up about breakthrough infections with the vaccination. And I think one of the things that Dr. Youssef mentioned, Dr. Stutz has mentioned, is that we're not seeing these folks in our hospitals. We're not seeing them in our ICUs, and we're not seeing them on the ventilator. The vaccine itself does not form a force field around a human being to prevent the vaccine, to prevent the virus from coming in. An individual has to actually contract the infection for your immune system to mount a response. The rate of testing that we're doing right now, we're testing so many people that this is unprecedented. We've never done this amount of testing. So we're catching people who have the vaccine, have the virus in their nares, and the body is still mounting an immune response. That's not a failure of the vaccine. There are folks that are getting a bit sick from the virus, and those you could call that a breakthrough infection. But I think the numbers belie the actual effectiveness of the vaccine, because we're getting so much testing, and we're seeing positive results in those that are vaccinated. And that's just a misconception that's out there I wanted to clear up. So.
Okay.
And actually, I can add to that just real briefly by giving you a couple of numbers. So the overall breakthrough rate since we started giving vaccines and we started tracking that for our county has been 13%. So of the new cases for the last several months, 13% of them have been in vaccinated individuals. But those people are well. They're not going to the hospital. It's the other population that's ending up in the hospital, because the breakthrough rate for hospitalization from COVID is 1%. 99% are the unvaccinated for our overall number since we started calculating that. It varies from month to month, week to week, day to day, right? But overall, 13% breakthrough rate, and most of those people don't end up in the hospital.
Great. Okay, we're going to wrap it up, and thank you very much to our speakers. This has been very informative and given us a lot of food for thought. So what are we planning to do? Well, first we are recording this video. We will upload it and we will send it to all the participants that signed up. So if they want to view it again or show it to people, that they can do that. Then we are also going to review all of the ideas that came up this evening, about the mask mandates, getting the accurate information out on vaccines, and try to figure out what are the kinds of things that we might be able to do. It was wonderful. I thank all of you for all the work you're doing. And I didn't know really until tonight the magnitude of the problem, particularly in North County. And that's where I live, up in here in Wairika. That we have a North and South ICU was kind of an interesting, sad thing to hear. So great. I appreciate all of you. And we will, like I said, send out information to follow up and work on getting some of these things improved. So thank you very much. Okay. Bye.
Thank you.
Oh.